Welcome to Hidden Heroes Caregiver Education Week from the Veterans Assistance Commission of McHenry County and Elderwerks Educational Services. We are so glad you've joined us all week for the educational programs and hope that you're finding them as informational as we are. Today's speaker is Deana Liss. She's our social services specialist at Elderwerks. She's a fabulous human being. She's going to be talking about resources for those contemplating a move. Again, if you have any questions, please put them in the chat and we will make sure they're answered at the end of this presentation. And a quick reminder, tomorrow we're doing a summary of this week's educational events between Mike Iwaniki from the Veterans Assistance Commission of McHenry County and myself. I'm Jennifer Perel with Elderwerks. We're going to be answering questions live as well as just discussing what has occurred this week, what's going on, and what could be coming up soon. So stay tuned for that tomorrow morning at 10 a.m. So please welcome Deana Liss, Social Services Specialist with Elderwerks. Thank you.
Hello everyone, my name is Deana Liss and I am a Social Service Specialist here at Elderwerks Educational Services. In my 20 years of working with seniors and their families, I've had the honor to help families make decisions about what is best. And today I'm going to speak on the topic of should I stay or should I go? In this talk today, we are going to understand what challenges or concerns are in a current living situation. We're going to talk about different living and care options, how best to make a decision on what is best, should I stay or should I go, and then local resources and supports. Now, not everybody likes to hear this next thing. We need to plan, and no one likes to plan. We don't like to have to look at all the potential outcomes or scenarios. But instead of covering our ears or covering our eyes or covering our mouths and having this discussion, you all showed up today, and I thank you for that. Because it's going to help you, a loved one, maybe a stranger you come across, a neighbor down the street, someone in your church, or a distant relative. Let's talk about what planning gets us. Benefits of planning: maintaining control, awareness of all of the different options. There are many new choices in the field of senior care, senior housing, and the senior resources. A benefit of planning also is the ability to stay calm as the situation changes and avoiding that chaos and having to make a decision in crisis, which all of this will allow the senior, yourself, or your loved one to live your best life. Do any of these things sound familiar? My husband's had falls, 4 of them in the last month and a half. I can't tie my shoes anymore and have a hard time getting in and out of the shower. Mom's bills and mail are piled up. I don't think she's paid any bills in a month. Or a bounce check. I'm lonely. Or I don't want to leave the house. I don't want to go and be with family. Or maybe the lawn goes unmowed, or a tree branch that fell doesn't get picked up, or a pipe got burst and the water's just turned off and not repaired. The gutters, I can't clean them. I can't get on a ladder anymore. Multiple visits to the doctor and to the hospital. Changes in medications because of hospital visits. My loved one doesn't get dressed anymore. They don't change their clothes or they don't shower. Not eating anything of a real meal, but surviving on ice cream and cookies, losing weight or gaining weight. My clothes don't fit anymore. multiple calls with your family or your daughter, or mom's calling you all the time because she has a fear or she's forgotten something or forgotten she'd even talked to you. Forgetting appointments to go to the doctor, to meet a friend for a movie, to go to a granddaughter's birthday party. A friend, a physician, your chaplain, a nurse, or a family member is asking if you need more care, or your doctor is even recommending new care or different care. Do any of these sound familiar? Do any of these check a box in your recent memories? All of these lead into, should I stay or should I go? The challenges and concerns. So there are safety concerns. Safety concerns can be nutritional, they can be emotional, they can be physical, they can be environmental. Acceptance of help. Do I want help in my home, or do I want to go somewhere where I receive help? Do I need help? Is it help with care? Is it help with finances? Is it help with emotional support? Home maintenance. Do I want a company to come in and mow my lawn? Or do I want to have carefree living? Be in a community where everything is taken care of. All of that maintenance is now gone. Affordability. The budget you have to have someone come in and maybe help with something, or to move to a senior community. Support. Is that support coming from your family, your friends, local resources? Isolation. Is my home isolated? Am I isolated in my home? Do I want to be around other people? Do I need to be around other people? These next two are harder ones: financial exploitation or elder abuse. Speaking of these two, scams are out there and very evident for seniors these days, whether it is having someone ask for money and wanting cash or gift cards, to, unfortunately, there are some situations where you live is exploiting finances, or could have an emotional or verbal or physical negative impact on your life. If either of these are happening, please know there are resources and we would want to help with that. All of these things, these challenges and concerns, and which way and that way and this way and another way, all lead to being able to find the right path to happiness, where each human, each senior deserves to have in their lives. Now, knowing that there are safeties and concerns of all these different forms, what are your options? So there is in-home care and in-home resources to stay where you are, whether you're renting a property or own your own home, or living with family, or living in a more group home type of setting. There are senior communities as well. There's also a level that is temporary assistance, like a rehab or a respite program, or adult day programming, where there is some programming that happens throughout the day, a couple days a week. So it is something that can be short term. It could also be a longer term, but it doesn't cover 24 hours. Let's take a couple minutes and let's talk about senior living communities. This slide does a good job of sort of layering what is out there for senior communities. Let's just go through it and then we'll talk on each point. We have retirement living, active adult living, independent living, assisted living, supportive living, memory care, Alzheimer's care, and continuing care retirement communities. Now, they all have sort of abbreviations as well. And sometimes there is language out there that you don't understand, CCRC or an IL, AL, SLIF, MC, or ALZ. Those all are on the screen for you to take a look at. But let's start at the very top with retirement living and active adult. Those are communities. Sometimes these are an actual subdivision or a physical community where there are independent houses, or it can as well be retirement living buildings that might be more like a condo or a large apartment. And these are active adult. These are traditionally 55 and plus, and these are for individuals who need very little assistance at all. They're going to be very active and just want to be around others that are of their same level. Independent living is, for the most part, apartment living. And these, again, traditionally are they're more traditionally 60 and above, but you can find some that are a little bit younger in age. These are apartments for seniors that are active, that provide some safety and security and some amenities for them. Assisted living and supportive living are very similar in the sense that it is apartment living where 3 meals a day are provided, and then housekeeping services and, for the most part, laundry services as well are there. This level provides staff there 24 hours a day that can help in an emergent situation and can do scheduled care needs with assistance of activities of daily living. The memory care and Alzheimer's care level is everything that assisted living provides, but specifically to those that have mild cognitive impairment, or forms of dementia, forms of Alzheimer's, forms of memory loss. And for this level of care, it can range. Some memory cares are set up where they have different levels or different sections within a memory care. So you may have someone who is higher functioning in their memory care, maybe has just some poor safety awareness and has the need to have their medications provided because they might not be able to do it on their own, but they handle everything else themselves. Where in another section of that memory care, maybe someone who's a little bit more advanced and needs more assistance with their activities of daily living. The continuing care retirement communities are exactly that. It is traditionally a community that has multitudes of levels. So it is going to have the retirement living, independent living section. It will have an assisted living section. It will have a memory care section. And that together with a skilled nursing component traditionally will all be housed on one property, maybe different buildings, but would have it all encompassed in their own little community on one property. These options, all of the senior living options, are significantly private pay, except with your supportive living and your supportive living will accept Medicaid as well. Now, what isn't on here is skilled nursing. Skilled nursing would be a level of care when the needs are greater than assisted living or memory care. So they're a two-person assist, they have more medical needs, that would lead towards skilled nursing care. How do you choose between one of these levels of care? Let's use assisted living as an example. So you want to compare apples to apples. If I'm looking at a community that a senior is going to move in, we want to compare apples to apples, not apples to oranges. So I don't want to look at an independent living and an assisted living and try and compare them. You want to compare assisted livings to assisted livings. And as we looked at the reasons someone would want to move, we would use those reasons in how we determine which level of care and then which community within that level of care is best. And we'll talk about a little bit about that in a minute. But comparing an assisted living to each other. So it's not about the color of the paint on the wall when you're looking at assisted living. You are looking for what they offer in the services. So you want to know that the care is there. You want to know that assisted living A has a nurse on site 24 hours a day. Assisted living B has a nurse on site 24 hours a day. Assisted living A has a studio apartment at X dollars, where B, it's $100 more. You want to know that community A has a doctor who does rounds every week, where community B does it monthly. So when you're looking at, you want to make sure you're looking at the same things. One of the great things about not only our directory and our website, we actually have a whole list of questions out for a family or a senior to use when they are touring communities. And those things will help for that. Hospice and palliative care, this is in here because this is a resource for most families. And a lot of times people don't understand that this exists. Hospice and palliative care does not mean that the end is tomorrow or in 3 days. What it is here for is comfort. What it is here for is support. So both hospice and palliative do exist, and they can happen in the home or within a senior community. If you have more questions specifically on hospice or palliative care, please let us know, and we'd be more than happy to answer. But I didn't want to spend a lot of time on this slide. Selection. So we did just talk about comparing assisted livings to assisted livings. Now let's talk about if we're looking at a home care, if we're looking at bringing someone into the house, or we're even talking to one of the other resources, maybe a financial planner. You want to look at the resources that are out there for seniors. Now, I will say anyone that Elderwerks refers to, we have personal knowledge of, and we vet them. We make sure that they're good people, good resources, good communities. That being said, you want to make sure that any of these resources really do focus on the person. who that person is. So if this is for you or it's for your loved one, who is the essence of that person? Are they a school teacher in the past? Were they a farmer? Were they a lawyer? Were they a steel worker? Are they an introvert or an extrovert? Do you like to make big meals? Do you like to sew? Do you like to play bridge? All of these things are who that person is. So when you're trying to select a resource, whether it is a move manager, whether it's a home care agency, you want to make sure that that all aligns with the individual, because it needs to focus on maintaining that person's dignity, autonomy, privacy, independence, that it allows for choices, and that the family and the support system can be involved. And that's whether it's in a senior community or you're looking at it at home. All of that is very important to making sure the resource is doing what the individual needs. And it's important to make sure that that senior, that individual, is going to have that happy, healthy life that they deserve. Making decisions. So we've talked a little bit about should I stay and should I go, and the things that lead into the questions of why you start asking, should I stay and should I go? Making a decision sooner rather than later allows for greater choice and independence. That again is allowing for more control. Socialization is just as important as an exercise to the body. Exercise helps the mind, the body, the spirit. Socialization does the same thing. There have been recent studies that have showed that isolation for anyone, but in particular our seniors at a higher percentage, when they isolate, there are higher cases of anxiety, there are higher cases of depression, there are higher cases of chronic illness, and unfortunately, there are lower numbers in regards to life expectancy. So being social and being able to have those resources in the house to be social, or to find a senior community that can support the social interactions that are needed, are very important. Again, going back to now, personality is a huge part of choosing a new lifestyle. Again, it goes to the essence of who a person is, and it goes to what services they will need. But you want to be able to honor yourself, if this is for you or your loved one, to make sure that they have what they need, and to be able to do that honoring the person that they are. Decisions, more decisions. Are you able to live independently in your current residence? Or if you're looking for a loved one, are they able to live in their own home? Do you feel safe, or do they feel safe? What works well in the current living situation and what does not? Are you being social? Are you being isolative? What would you like to do that you're currently not doing? If mom or dad or your husband or your sister or your brother loved playing bridge and they're not doing it. What is the reason they're not doing it? Can things change to be able to put things in place to allow them that passion again? Do you want to do more, to be more active, to live more? Each person's definition of living more is different, but do you want more? Do you just want to sit in front of the TV and that's all you want to do? Do you want to go and do? Do you want to go to the movies 3 days a week? Would you like to go out shopping more often? Even if you don't buy anything, would you still like to go? What gives you the most joy each and every day? Do you have any fears? Are there things that keep you up at night wondering whether it's for you or it's for a loved one? And why do you think you have those fears? And then this plays into your decisions. What is your budget? Where do the finances come from? And how long will they last? All right, so we've talked about lots of questions. We've talked about how to make decisions. We've talked about different decisions to make. Now, how would you decide to stay or to go? Here are some of the most important considerations: our care needs, our wants and desires, our budget, and a location. So let's break this down. Care needs. Being optimistic and realistic. What care needs do you have, or does your loved one have? Is it meals? Is it help with showers? Is it help with transportation? Is it help with incontinence management? Is it medications? Is it getting dressed? What are they? And being optimistic and realistic. They're here today. Where do you see it going tomorrow? And staying positive about it. It's not about taking someone's abilities away. It's you want them to use what they have to do what they can and then support that to keep the independence, whether they stay in the home or whether they move into a senior community. Wants and desires. Let's be real here. I may want to go horseback riding every day, but is that realistic? It isn't for me now. I can't picture me in another 10 years either, but it is a want and a desire. Is it realistic? And when we're deciding between care needs and wants, we always want to go where the care is going to come first and the wants and desires come second. Meaning, it doesn't matter the color of paint on a wall, or if steak is on the menu every Thursday or bingo is every Wednesday. You want to make sure that the care in any community comes first and those needs are met. And then you do want the wants and desires to be there as well, but the paint on the walls or a 1-bedroom versus a 2-bedroom in a senior community isn't as important as everything else that fills for that senior's overall happiness and healthiness of their life. Budgets. The third thing on this list is, the assets determine the affordability. So knowing how you're going to pay for it. And we're going to talk about that in a little bit, but looking at budgets and looking at realistic budgets. A lot of people believe that staying in the home is the only option because they can't afford senior living or a senior living apartment. What they don't realize is actually being able to compare apples to apples, if you will. What's your electric bill at home and what's your electric bill in a senior community? What's your garbage bill at home? What's your garbage bill in a senior community? what's your food cost at home and your food cost in a senior community. So deciding where your budget is, but then making sure you're looking at both scenarios clearly. Location, near a support system of family or friends. This also applies to, for a lot of people, their church, their synagogue, their religious affiliation, but it also applies to staying close to a physician or a health care network. So location is important as well. So when you look at how to decide, these are 4 key considerations, and each can lead you down a different path. How to pay for care, as we just talked about ever so briefly. Here are a couple of different options when people are paying for care, whether this is in home or you are in a senior community. So paying with private funds, personal assets. So you're going to look at your home, you're going to look at a 401k, a pension, an annuity. Some people have trusts. Those are options within the personal assets. Then reverse mortgage and using leverage with your home to get money out of it. Long-term healthcare policies. Let me stop here for just 1 second on this topic. So this, what I'm referring to is called a long-term healthcare policy, or an LTC. This is not your secondary insurance, and this is not a supplemental insurance. This is specific for long-term care. Now, each policy is written differently, so each one may have different points in it. So it may cover different things for long term. So it may cover things in the home or in assisted living. It may cover things in skilled nursing. It may cover a combination or one of those things. There's also predeterminants, as well as what indicates that policy starts and for how long. So I always ask individuals to take a look at their long-term policy and then speak with the insurance as well. We also at Elderwerks have other individuals and resources that you could speak with to clarify. Veterans Aid and Attendance. Thank you all for joining us for Veterans Caregiver Week. And I know earlier this week we had a presentation on aid and attendance. This is another way that our veterans, through their service of our country, do have benefits that come back to them. And then Medicaid. For those of you who do not understand, Medicaid is different from Medicare. Medicaid is for a low or no income, and that will help at skilled nursing, supportive living, and for some assistance in the home. It doesn't pay for everything at home. Legal aspects. So legal aspects, when you're looking at having to move, should I stay or should I go? I know earlier this week we were honored enough to have a legal presentation, and so you can look at each one of these a little bit more in depth in that presentation. But the main thing I want with this slide is to explain that just because you're on mom's bank account or you're on your husband's bank account, that doesn't mean you have power of attorney for healthcare or for property. So you really do want to have a legal healthy checkup, like you'd have a healthy checkup with your physician. You want to do that as well with an elder attorney to make sure things are lined up. Your advance directives, as far as if you choose to be a do not resuscitate or you want to be resuscitated, do you want a feeding tube? That plays into the advance directives in your living will. Your will, separate from a living will, is not for when you are living. there are different kinds of trusts. And then there comes a time when decisional capacity comes into play and guardianship. So if someone loses their memory and they don't have powers of attorney in place, there may be a time where you need to go through the legal system to do guardianship. Going on to different resources that are out there, the Area Agency of Aging has a program that is federally in the state of Illinois funded, where organizations such as Catholic Charities and Senior Services Associates and multitudes of other here in the state of Illinois do provide resources for low-income families. It can be everything from the Meals on Wheels program to maybe some in-home care, and those exist for those low-income families, seniors, to support them and help them stay at home. This is a big slide, and this is, I'm going to touch on most of these fairly quickly. First, our Elderwerks directory is a 340-page directory that holds all of these different resources in one spot. It is a project that is currently going on for our next directory to come out. And it holds resources, it holds articles, it holds senior centers. It has a ton of information. But the neat thing about what we do here at Elderwerks is make sure that seniors and their families know of these resources. So when someone reaches out to us, we help them find what they are looking for and understanding their story to provide those supports. So whether it's transportation at low or no cost, or maybe it's a special type of transportation, then we have things that deal with social services, social work therapists, mental health, that are resources that would be covered by most likely your insurances and different things like that. The patient advocates and geriatric case managers, those are normally a professional that's going to help guide start to finish through either a health issue or the overall care of a senior, but these are paid professionals that you're going to pay privately. They're not covered by Medicare or insurance. Veterans assistance is out there, and we can speak more to that if you have specific questions. Home upkeep programs or home improvement programs are out there to help make adjustments for a senior to live at home safely. These will have some fees, some don't have fees. Then if we take a look at financial advisors, trust managers, elder attorneys, those are going to be more private pay services that are out there to ensure that the funding that someone has, the beliefs someone has are going to be handled properly. Then when we look at Meals on Wheels, the different township programs, the different governmental agencies and governmental officials, village nurse, and the police social workers, these are all programs that are available traditionally to seniors and in most cases low income, that are there and provide for seniors, whether it's a meal, whether it's an exercise class at the township. The village nurse also will help with different things. The police social workers also can provide crisis assistance when needed. Senior move managers and moving companies are there to help and ensure that seniors are taken care of when they are moving and they have accreditations, just like real estate agents that are senior certified as well. Memory care screenings, home care, and support groups are other resources that we utilize for a lot of families. Those screenings for memory screenings are good for a baseline as well as to see the progress, and to make sure that that senior is getting everything they need. Also, side note, sometimes the memory screenings find other things like a hearing decline, which means they're not forgetting things, they just don't hear them. So sometimes that can be an issue as well. Now, when you're looking at any of these resources, Elderworks does vet all of them, but you want to be able to ask those questions and really ask what is going on within that particular organization and how their services are going to be there. If this is a service you are paying for, whether it is a financial advisor or home care, you want to make sure to ask, can I have this in writing? What does the payments structure look like? If you're not able to, or if that caregiver isn't able to be there, how is the service going to be done? And different things like that. We have a bunch of resources that we can share with you for interviewing and finding the right resource. I love this slide. Tomorrow is never promised. Remember, you only have one ride through life, so give it your all you've got, and enjoy the ride, by John Gordon. When you think of that, we do only have one life, and it's worth living, and we want to live it the right way. We want to live it with everything we are and as healthy as we are. Thank you for joining us today. This is a little bit about our organization, Elderworks. We are a 501c3 organization, and I'm proud to say we've helped thousands of older adults and seniors age well. We were able to stay open and helping seniors through the COVID pandemic. How we do that is with senior living coordination, supportive referrals, advocacy, and education. We do have our Better Aging Expo, which will happen on August 31st in Hoffman Estates. We will also be doing that virtually. Elderworks is funded by grants and donations, fundraisers, senior community support. Thank you.
Great job, Deana. Can you hear me?
Yeah, I can.
Okay, good. It's hard to present when people aren't live and asking questions in person, isn't it?
It is, and I mean, Elderworks is what we do. It's a passion, and there's so much to give to each senior, and to make sure we honor them for who they are and that they get the care, whether it is a veteran or a senior, whether they have a family or they don't. It can be a little overwhelming, and our team, which I'm honored to be part of, takes the time to understand that. And that's something that makes us a little bit different than any other agency that is out there. It's about the person. It's not about a number. And presenting to a computer is a little bit different than talking with someone.
Daunting.
So I apologize that was a little bit scripted, but the information is important to get out there.
100%.
I have a butterfly on my head. Here, let me move.
It's a very large butterfly. Yes. So what people have to understand is that Elderworks treats each person as a person and not as a commodity, and not as their disease or their limitation. The only limitation anyone has on life is their own selves. And that's how we feel. We try to give people the ability to make decisions on their own. However, by the time a lot of folks get to us, the older adult and the senior haven't made the decisions and planned for their futures. So we're working with a lot of folks in crisis, and that's why Deana is here. Deana Liss is our social service person at Elderwerks, and we love Deana. She helps thousands of people that didn't plan well or just didn't plan on living so long. So thank you, Deana, for being such a great part of Elderwerks. I know that our team members are all awesome, honestly. I got nothing bad to say about any of y'all because I love everybody at Elderwerks, even if I didn't, work there or found it. All great people. So that's my commercial. But some questions. I don't see any questions from anyone in the audience, so I will ask you some questions. And some of my questions are like, how do you do it, Deana? How do you help someone who hasn't planned well and has outlived their money, who may or may not have any physical or mental issues? They might just need a place to live, and there's a limited amount of senior apartments in Illinois. What can people do in that situation?
So this is the toughest question you could give me right now, because
I know
the affordable housing market in Illinois, and let's be honest, across our nation, after the pandemic, it wasn't great before, but the pandemic has made it a little bit more difficult. So, I mean, it's talking with that senior about what's most important to them, what they do have for financial resources, exploring options for financial resources they may not have known that are out there, utilizing the professionals within our resource professionals that we use on a regular basis. It isn't unusual that we have someone call us that is homeless, and what they need is somewhere to stay tonight, and being able to get them that for tonight or tomorrow, and getting them hooked up with the social worker within that program that helps them through the system, if you will. We also get people who are just very much, they're in an affordable housing situation for them, but they're paying their rent and they don't have money for food. So it's being able to hook them up and get them connected with food pantries or utilities. There are programs within Illinois that help low-income individuals with paying their utilities. Some of these are short-term fixes. Some of them are longer term, but it's really getting to know that individual, and in working with that person and understanding what their flexibility is going to be on location. If you're in Southern Illinois, out in the middle of the country, the housing may be different there than in the middle of Chicago proper, and knowing those resources. And sometimes we don't have the answer, but I'm hopeful that every senior knows when they've spoken to someone at Elderwerks, they've gotten to a resource that will help them, and being able to find that. So we end up providing those resources and connecting those seniors with those resources.
So the families I've helped, which is not many, because as everyone knows, I'm never around. I'm like, well, you don't want to talk to me. Talk to my experts in my company. But what I always tell people is your loved one willing to accept help? And there are a lot of vain people. There are a lot of people who will not accept help because they're like, I can do it myself. I don't need help. I'm good. You're not good. If you were good, your family wouldn't be calling, freaking out, right? They wouldn't be calling saying, mom's declining. Mom's not doing anything. She's lost 20 pounds. She weighs 85 pounds now. We're very concerned. And then they contact Elderwerks and we try to help the older adult. The issue is it's uphill now. This is not a planned event. This is not someone willing to accept help at this point. At that point, The only thing we can say is you're going to have to wait till a crisis. Is that what you would think, Deana? What would you say in that instance?
So in that case, yes, sometimes it is in a crisis, but I think it's also being able to guide that adult child to have you had that conversation, or at least let your concerns know to the medical professional. You know, what steps have you taken? And we earlier this week had a legal expert on from Peck Ritchie, and I would tell people listen to that recording, because there are specific things. If a senior is still found decisional, they have the right to live their life the way they want without hurting someone else. They can't hurt someone else, but they can, to a degree, not be taking care of themselves efficiently.
Kind of.
But that's also when it comes into, sometimes families connect with adult protective services, and things are open that way. Sometimes that happens through the hospital system if they're the repeater in the ER for multiple falls or dehydration. But that adult child needs to also, you can't tell mom and dad what to do. You can say, Mom, this is why I'm worried. And I think one of the things that Gail, Carol, Barbara, Tamara are really good at doing when they're talking with their families as well. And if I've missed somebody, please shoot me later.
No, don't shoot anybody. No.
Don't shoot anybody. You can, yeah, we'll figure that out. But having that conversation with the adult child on how to speak with mom and dad to get them to see those things. You can take mom grocery shopping and provide groceries. It doesn't necessarily mean she's going to eat. And so being able to have an open, honest conversation that is a non-confrontational, I think leads to it. And yes, you don't want to be making those decisions in crisis, because when you make a decision in crisis, it's because the options are limited and you're not clearly thinking. And so whatever a senior or the adult child can do to prepare is always going to be better.
Right. I agree. The decisions they make, whether good or bad, are their own, and they have to own up to those, unfortunately. Sometimes we have to wait. One thing we should watch for is hoarding tendencies, because hoarding is against the law in the state of Illinois by an older adult. It is considered self-neglect, which is against the law. So you can get help for someone in that case. Now, if your parent is living at home and they're doing fine, but they're spending money like water, well, guess what? They get to spend their money like water. It's their money and it's their decision. So that's something
as long as somebody is not financially exploiting them.
Right. Correct. I'm talking about, for instance, they like office supplies and they like clothing and they like shoes, and that's their choice. It's unfortunate because they're limiting their ability for their future for care, but it's still their choice. So.
It is their choice. And just as recent as about 2.5 weeks ago, we had a senior that said, I shouldn't have been spending money on this, and this, because now I'm in a situation where really, I'm living on Social Security, and that's it. And so that has to pay for my food, my utilities, and the roof that I can. Yep.
Yeah, and that's a problem, because Social Security is not going to help people, really. If you're just living on Social Security, you are limited on income. You're probably going to have to go in subsidized housing, and if you ever need care, you can go into supportive living or skilled nursing. But your choices are limited, and no one likes limited choices. Everybody likes choices, abundant choices, and unfortunately, in that case, you don't have them. For those who do plan well, what they can expect as they age is what, Deana?
If they plan well, they're going to feel more in control of their life. They're going to have happiness to what they want. And the options are more prevalent if you've planned correctly. So it might be staying at home and bringing in a caregiver, 12 hours a day if that is needed, or it might be moving into a community where they can, play bridge 3 times a week, and, they never have to cook a meal again, and they can, live, let's say, in a parked cruise ship all the time.
Yep.
That allows them those opportunities. Planning is truly everything. And I'll be honest, when I'm working with the adult child, I'm telling them they better get their stuff together.
100%.
The baby boomers are we're seeing that come in, and the generation after, it's going to limit some things if you don't plan.
Yep. And if people don't take anything else away this entire week of education, the one thing they need to take away is plan, and then plan again. I have been planning with my mom and dad since my dad was 60. He's now 83. Every single year I have a conversation. So this is where you're at. What do you want? What do you want for your future? Every year. They've not had any need to move into any type of senior living yet, but they will. And what does that look like? Well, I know because I've had conversations every single year with them. And it's not about now. It can be about future needs. Well, what does your future look like? Does it look like you want to stay home? Well, let's make sure you have funds to stay home with your caregiver or help of some sort. Or if it is moving, what does that lifestyle look like? Do you want to live in a small place? Do you want to live in a large place? Suburban, urban, all of those things. That is a personal conversation that the person who loves the senior is going to have with them. And if the senior's smart, they'll open up and discuss it. If they do not share this information and they do not tell people what they want, they are the ones that are going to receive whatever they receive, good, bad, or ugly.
Right. And I think the other way of saying that is planning allows for independence. It allows for you to have your stamp on your future. And to do that, you need to plan. How many people call us and say, I'm on mom's bank account, so I need to move her, and this is what I'm going to do. No, no, it doesn't work that way. I had a neurologist in a previous job I had who had memory loss, and he wrote a book, and he said, I treated patients all my life, and he got Parkinson's and he got memory loss. And he says, I know what I'm doing, and I'm planning for it. And I use that a lot of times when I speak with families, because if you can plan for the worst, you will normally have the better option. You will have the better future because you did plan.
Right.
And it's as simple as letting someone know and meeting with a lawyer, getting those advance directives done.
And if they don't have anyone, they can hire someone to be their representative.
Yeah, because you want those decisions to be made. I've had I'm not a senior. I've had that conversation with my husband, my sisters, my nieces.
Yep.
They all know what I want if I can't make a decision for myself. It's just something that everyone at Elderwerks really does tout. Do that. You're making decisions, you're planning.
Yep. Open up your minds, listen, learn, plan. Exactly.
Yep.
Thank you, Deana, for all of your help. And we love you at Elderwerks, and we hope that your families that you're serving love you as well. So you have a great day. Thank you.
Thank you.
Bye-bye.